Good afternoon. The following presentation will focus on the theory of planned behavior. We will describe this theory in further detail later on. Our group will also present our article that is titled Effects of Monitor Alarm Management Training on Nurses' Alarm Fatigue. This video will be presented by Natalie Alberto, Kaylee McDonald, and Samantha Mitchell. By the end of this presentation, you will be able to answer the following objectives. You will be able to describe the theory of planned behavior, list and explain at least two constructs related to the theory of planned behavior. You will be able to describe how the theory of planned behavior was used in this intervention. You will be able to describe how the theory of planned behavior was used to reduce alarm fatigue in intensive care unit nurses. And lastly, you will be able to list at least two disadvantages of alarm fatigue.
The theory of planned behavior, also known as TPB, was founded by Isaac Ashgen in 1985. His theory was set to explain that behavioral achievement depends on both motivation, or intention, and ability, or behavioral control. It distinguishes between three types of beliefs: behavioral, normative, and control. The theory of planned behavior consists of 6 constructs that collectively represent a person's actual control over the behavior. You can see these 6 constructs listed here in the diagram: behavioral beliefs, attitude toward the behavior, normative beliefs, subjective norm, control beliefs, and perceived behavioral control. Attitudes is the first construct of the theory of planned behavior that we will touch on. This relates to the degree to which a person has a favorable or unfavorable evaluation of the behavior of interest. It entails a consideration of the outcomes of performing the behavior. This means that no matter the person's situation, whether they are surrounded by gold and shine or dirt and grime, their behavior will be reflected by their attitude. Behavioral intention is the next construct we will explore. This construct relates to the motivational factors that influence a given behavior, where the stronger the intention to perform the behavior, the more likely the behavior will be performed. This relates to the saying, "You can do anything you set your mind to." Subjective norms is the belief about whether most people approve or disapprove of the behavior. It relates to a person's beliefs about whether peers and people of importance to that person think he or she should engage in the behavior. Social norms are the customary codes of behavior in a group of people or larger cultural contexts. Social norms are considered normative or standard in a group of people. Perceived power is defined as the perceived presence of factors that may facilitate or impede performance of a behavior. Perceived power contributes to a person's perceived behavioral control over each of those factors. The final and newest construct is perceived behavioral control. This is defined as a person's perception of the ease or difficulty while performing the behavior of interest. This construct can vary depending on the situation and actions, which can result in a person having varying perception of behavioral control depending on the situation.
Now that we've discussed the theory of planned behavior, we can go into detail about our article. As mentioned earlier, our article is titled Effects of Monitor Alarm Management Training on Nurses' Alarm Fatigue, a randomized controlled trial. The objective of our article was to evaluate the effect of monitor alarm management training based on the theory of planned behavior for reducing alarm fatigue in intensive care unit nurses. This was a randomized, single-blind trial. The participants in this study included 93 ICU clinical nurses, and they were randomly assigned into 2 groups. In order to be included in the criteria, the nurses had to be certified registered nurse, engaged in critical care nursing, and independently worked as a nurse for more than 1 year, and they had to have volunteered for this study. The study was conducted from February 2019 until May 2019 in a tertiary A-level hospital.
The 93 total nurses who participated in this study were randomly divided into two groups: the experimental group with 47 nurses and the control group with 46 nurses. The experimental group experienced a 12-week alarm management training course modeled on the theory of planned behavior, whereas the control group experienced regular training. The nurses in both groups had their alarm fatigue scores measured with a questionnaire before and then again after the training sessions. It is important to note that the intervention did not cause any adverse effects for patients in either the experimental group or the control group. The results by the analysis of independent samples one-way and COVAs showed that the nurses' alarm fatigue post-test scores in the experimental group were lower than those of the nurses in the control group. The independent sample one-way and COVAs were used to detect the differences between these two groups. Additionally, the total number of alarms and non-actionable alarms recorded within the experimental group were lower than those recorded within the control group as well. The intervention shows that this was effective in increasing nurse awareness and the behavior of the alarm management in the ICU. According to this study, based on the premise of the theory of planned behavior, alarm management for ICU nurses can be adjusted through training of perceived behavioral control, attitudes, and subjective norms within the work environment. For many of the nurses, their worries on alarm management consisted of severity of the patient conditions on the unit, heavy workloads, and the inability to detect alarms in a timely manner. The training that the experimental group experienced housed the psychological factors involved in the formation of conscious behavior in order to train these nurses to have positive attitudes, practice by the evidence-based practice methods, and overall increase their recognition and understanding of alarm management. The research from the study showed that through the theory of planned behavior, they were able to transform the nurses' knowledge of alarm management into a learned behavior. This greatly reduced their mental stress as well as reduced alarm fatigue. As a result of these findings, it would be useful and beneficial for more ICU nurses to receive these specialized alarm management training programs to overall improve alarm management and reduce alarm fatigue among the intensive care unit nurse population.
A non-actionable alarm refers to an alarm that a clinician considers to not be clinically significant. Previous studies showed that 89 to 99% of clinical alarms were considered non-actionable. Long-term exposure to a large number of non-actionable alarms can cause nurses to either ignore the alarm or delay their response to them, and this is referred to as alarm fatigue. After a critically ill patient receives intensive treatment for a complex condition, it is necessary that their vital signs are to be monitored in real time. In the ICU, individual patients can have anywhere between 63 to 187 alarms. Majority of these alarms are non-actionable and they do not require immediate action from the nurse. All of these alarms put nurses at risk for alarm fatigue. Alarm fatigue is dangerous because it puts the patient's safety at risk. If nurses are experiencing alarm fatigue and not responding to certain alarms, it increases the risk of the nurse potentially overlooking a serious event, thus causing injury, harm, or even death for the patient. Another disadvantage of alarm fatigue is the negative impact on nurses' mental health. If a nurse is experiencing alarm fatigue, they are going through a sensory overload, which can result in desensitization. This in turn negatively affects not only their personal life, but their ability to perform necessary job functions for both the patient's safety but their own as well. This can range from simple tasks like performing hand hygiene incorrectly or not at all, to grabbing the wrong equipment when preparing for an important and stat procedure. In order to prevent alarm fatigue, the nurses must participate in alarm management. The aim of alarm management is to prevent alarm fatigue by reducing the number of alarms. Nurses can reduce the number of alarms by decreasing the number of non-actionable alarms. Therefore, alarm fatigue will also be decreased. Alarm management is important because it prevents deaths and improves the safety of the patients. Previous studies have shown that 216 deaths resulted from improper alarm management. This reinforces how important it is that nurses can decrease non-actionable alarms and improve their alarm management skills.
To conclude our presentation, we would like to recap that this study was designed based on the theory of planned behavior. With that, the psychological factors that affect ICU nurses' alarm management behaviors were also considered, such as a heavy workload and having very critical patients to take care of. The goal was to help reshape nurses' behaviors and intentions in alarm management on the unit, promote the conversion of evidence-based knowledge into everyday practice, and overall reduce the number of alarms, which ultimately lowering the nurses' alarm fatigue levels. The results of the study concluded that the 12-week alarm management training was successful in lowering alarm fatigue among the nurses. Thus, it is recommended that alarm training programs are implemented to all intensive care units to overall improve the nurses' ability to manage alarms and to not experience alarm fatigue when working on the unit.